chukua fursa hii. Hili hapa Muhando branch kuna madaktari kutoka Gakani. Tuko na madaktari kutoka Moi Teaching and Referral Hospital. Tuko na madaktari kutoka Children's Sickle Foundation.
I'm a woman, I'm a girl, diamond pearl, so much more. I can change the world, yeah.
I'm a man, I'm a boy, businessman or employee. I can change the world. All I'm trying to say is, doesn't matter who or what you are, if we put our minds together and lend a helping hand, stand firm cause we believe in love, peace and harmony. You can, I can, we can change the world.
Today is a great day for us in Homabay and for the people with sickle cell disease and their parents and their relatives.
I'm 24 years of age and I'm a Sickler, and I'm from Mombasa, and I'm proud to be at Homabay today representing all the warriors countrywide and all over the world.
How come there's so much awareness about HIV/AIDS and the people don't know about sickle cell anemia or sickle cell disease?
I was diagnosed with sickle cell when I was 7 months old. And ever since, it's just been a roller coaster of, trying to manage the condition well.
The birds so high shine.
Number one on the list of the activities is creating awareness. People must know sickle cell disease is there, and they have to know the truth about it so that the myths can be removed. Then number two, it is also bringing partners together so that at least we get contributions. You know, one person cannot manage everything. So we have to bring as many partners together so that we cooperate together. Number three is also to offer services, because the same day also the sicklers and people would want to know their status are getting screening services and getting drugs. Homabay is an area where the sicklers are many. You know, this disease is common in the coast region and the lake region. And Homabay is one of the counties with, I think, the highest number of sicklers.
Having sickle cell anemia doesn't mean that this is the end of you. Yeah, you can live like any other normal person outside there. The fact that you have sickle cell anemia doesn't mean that your dreams can be shattered or anything like that. It's up to you to take the step of realizing your status and going positively about it.
The gene that leads to this condition is so common that if I stood out there on the streets of Homabay town and I counted 1 to 10 people, about 3 or 4 will be carrying that gene. It takes 2 to tango. For one to be born with the sickle cell disease, both the parents must have contributed. And I think the drama team really helped to bring that one out. You cannot get the disease or for you to be sick from sickle cell condition unless your father and your mother have contributed to those abnormal genes. So everyone must take 50% responsibility.
I'm a chef and an image consultant in Nairobi. And it's sickle cell is not something that keeps you from doing whatever you want. You can be whatever you want, really, until such a time that God calls you like any other person. You're more likely to be hit by a bus than to die from sickle cell. Today has been quite emotional for me. I was privileged to have, at least to have the condition managed from 7 months. I have very good doctors, Dr. Afula, Dr. Kinuthia. They've been managing my condition from very tiny, and so for me, I never really knew the real sickle cell that I've seen here today. Today has really been sort of a game changer in terms of being an eye opener as well, because I saw kids with the condition, and it's so scary. It was very emotional for me. I couldn't even sit at in the tents for long. Medicine has been brought. The kids have got at least a way forward, even if it's for 1 year, but they have something to hold on to for the next 1 year, and the next year will take care of itself. So today has been very, very important, and I would encourage the organizers of the event to do more of this in the Nyanza region, in the coastal region, because that is where it's most prevalent.
Mimi natoka Moi University na tuko hapa kwa sababu ya interest yetu ya sickle cell disease. Tunajua sickle cell disease iko genetic disorder. Ukiangazia macho utaona wagonjwa wako wengi. Kuongea na madaktari wengine kwa mahospitali kadhaa huko Western Nyanza wanasema ward, wakienda kwa ward ama kwa hospitali wagonjwa wa sickle cell disease wako wengi. 3/4 of the ward ni wagonjwa wa sickle cell disease. Kwa kweli hao wagonjwa wako na hatujui tuko nao wangapi hapa Kenya. Ukiongea na mtu atasema nilikuwa na relative, neighbor nini, na hatujui wako wangapi. Sasa kwa hiyo information tumeanzisha sickle cell disease registry. Nataka tujue tuko nao wangapi na prevalence, yani wako wangapi katika hii Kenya yetu, na tutataka kuandikisha hiyo activity. Tumeanza, lakini officially we are trying to kick it off today.
Tulikuwa tuna celebrate World Sickle Cell Day na event yenyewe ilikuwa inahusika sana na mambo ya sickle cell. There is a time watu wa Ampath walikuja Homabay. When they come wali call screening. So wale watu walikuwa na expect walipata overwhelming number. So they walipata big number, si watu vile walikuwa na expect. Walikuwa na expect to treat watu kama 200 but walipata watu 3000. Tulikuwa chini kama organization. Wale watoto wao wako na sickle cell. Ikawa wakasema what can we do? Because tukapata hizi drugs, they are very expensive. So on that day walinichagua kama chairman wao. So the reason nilifanya watu wakanichagua ilikuwa niende niongee na county government ikiwa watasubsidize hizi drugs, sababu drugs kama folic acid is very expensive to us, because this region watu wengi wagonjwa wengi they are there but they are poor. Unapata hydroxyl tablet moja ni 40 shilling. So kama tunaweza pata drugs alafu ile awareness inaweza kwa tunaweza shukuru sana. This foundation inatusaidia kupata like a support group. Tunaitana kwa kila sehemu tunatoka, tunapeleka mafunzo pale, tunapeana mawaidha. Ikiwa mtoto iko kwa crisis, inafaa dawa gani tumpatie atoke kwa crisis.
Sickle cell warriors live a full life. I would like to thank Homabay County, starting from the governor's office and then going to the ministry and also to the Homabay County Hospital. They have been instrumental in this event and they have embraced it in a way that we as a community are appreciating each and everything that you've given us, the support and the love especially.
It is a disease, it is a problem, and it is a burden we have in Homabay. We cannot run away from it. It is the duty of the county government to provide services. But the county government alone cannot do everything, given the resources we have. So number one thing on the list, the way I've told my technical people, they must come up with a very clear programs and activities and resources required for us to run the program within 2 weeks' time. Then the next thing, we must identify our partners, friends, who are likely to come to help us implement this program. This day, it has come as a result of many partners. It has also brought a number of partners together. so that we work together. One on the list is the Children's Sickle Cell Foundation, plus many other partners.
Those of us who are in the healthcare system should join hands so that we can allay the pain which those people with sickle cell disease undergo in terms of biopsychosocial pain, so that we can make them live a life that is actually wholesome as they achieve their goals towards their life.
I call Joyce a warrior because she's a simple girl who's believing her dreams. In spite of her being a sickler, she's never looked down upon herself. She's living her life like a normal person, and she has her dreams.
Out here you see the real sickle cell. Yeah, you see what it actually means to have sickle cell.
Raha yangu itakuwa ni kama wale watoto wako na sickle cell, na tamani ama tunapenda kuona kama wana smile.
Yeah, like a doctor or a priest, treat the sick and heal our streets. They can